Are you afraid of contracting HIV infection and you're just wondering what you need to do? This video is what you need, because in today's discussion we shall be looking at how to prevent or avoid acquiring HIV infection through the use of medication or Arvs that you normally refer to as PrEP or pre-exposure prophylaxis. Stay with me. So welcome back, good people, to Community Medicine, a channel discuss matters health. Let's keep subscribing, let's keep sharing the video, and in case you have a query or a comment, you can put it below in the comment section. So PrEP or pre-exposure prophylaxis is medication or Arvs taken by a HIV negative individual who is at a substantial ongoing risk of acquiring HIV, or an individual who is constantly at a risk of acquiring HIV infection. So PrEP works by preventing the HIV virus from establishing a permanent HIV infection in the body in case one gets exposed to the HIV virus. So who are these individuals who are at a risk of acquiring HIV infection? So we have a HIV negative individual who has a HIV positive partner who is not on Arvs, or who is not taking their Arvs properly, or who have poor adherence, or who have taken Arvs for a duration of less than 6 months, because you need to have taken Arvs for at least 6 months in order for the amount of the virus in the bloodstream to be suppressed, or for one to be virally suppressed. We have an individual who has multiple sexual partners. We have an individual who constantly uses PEP or pre-exposure prophylaxis. We had looked at PEP in a previous video. You can revisit the video. I'm going to leave a link on the comment section. Yeah, so we also have individuals who normally engage in sexual intercourse while under the influence of alcohol or recreational drugs like heroin, cocaine. And then we have individuals who constantly get infected with the sexually transmitted infections. We also have people who normally inject drugs and share needles. We also have men who normally have sex with men. And we also have sex workers. So all these individuals are at a risk of acquiring HIV, or are at an ongoing risk of acquiring HIV infection. So PrEP should be taken every day at the same time without fail for it to produce desirable effects. And actually PrEP is a combination of two Arvs, which can either be TDF and FTC, or TDF and 3TC. Once you feel that you're at a risk of acquiring HIV, visit a healthcare provider, and they'll be able to determine or assess and determine if you're at a risk of acquiring HIV. And they'll also be able to check if you have signs and symptoms similar to those of acute HIV infection. They'll also be able to check your HIV status, because if you're HIV positive, you'll not be put on PrEP, rather you'll be started on care, or you'll be started on Arvs. And they'll also be able to check if you're willing to take Arvs, because if you're not willing, you cannot be started on PrEP. Remember, it takes 7 days or 7 doses of the Arvs in order to achieve adequate amount of Arvs in the body tissues for it to be effective. So during this duration, or the 7 days, you should observe safe sexual practices. Now, if you're below 35 kilograms and or below 15 years, you do not qualify to take PrEP. So once you've been started on PrEP, you need to go for a follow-up after 1 month, and then after 3 months. So during these follow-up visits, your healthcare provider will be able to identify if you have any side effects, if you're taking your HIV, your Arvs or your PrEP faithfully, and they'll also be able to run a retest of the HIV infection. So that is all we have for today. Thank you very much for your time. Don't forget to subscribe, to like, and to share this video. Bye bye.